Assalamu alaikum, the communication day. First scenario, Mrs. Charlotte, 25 years old. She is a young woman who was diagnosed with rheumatoid arthritis 3 months ago after presenting with painful swollen joints in her hands and knees. Diagnosis was confirmed by your consultant during her last appointment. She wasn't keen on starting treatment at that time, saying she would like to go home and think about it. She only takes paracetamol and ibuprofen for the joint pains as required and is on no other medication. Your consultant feels that she should be given steroid if she has another flare-up of the rheumatoid arthritis. He's also considering disease-modifying agents such as sulfasalazine, methotrexate, as she already has 8 to 10 joints affected, not severely. She works as a chef in a top London restaurant and lives at home with her parents. Ready to start?
Yes. Yeah.
Yes, here you go.
Yeah. Hello. I'm
Hello.
Dr. Henry, one of the doctors here. May I confirm you are Mrs. Charlotte Mackin, 25 years old?
Yes.
Oh, pleased to meet you, Mackin. Do you prefer I address you as Mackin or Charlotte?
Yeah, thank you.
What do you prefer I address you with?
Macleans.
Mackins. All right, Mackins. Mackins, good to see you this morning.
Thank you.
How have you been faring since the last time we came to the hospital?
I feel trouble with my joint pain, and now the sickness become more even in my wrist.
Oh, so sorry to hear about that. But not to worry, we'll see how we can manage you through it. Is that okay?
It's okay. Thank you.
All right. And just to ensure that, we're on the same page, I want to discuss, concerning your health condition. And then just to ensure that we're on the same page, do you mind if you could tell me about your understanding about your condition so far up to now?
For 9 months, I started to complain from joint pain, joint swelling, and my body becomes stiff even in my joint. I sought medical advice from my GP, and he referred me to a joint doctor. At that time, he examined me and did a blood test and X-ray, and he said to me that I have a disease called rheumatoid arthritis.
Okay. That kind of surprised that you have good information about your disease, and at the same time I'm kind of not so happy because of the fact that you are currently not doing very well. But not to worry, you are in the right place, and we can do well to address all your concerns. During the course of our discussion, feel free to stop me at any time to tell me about your worries or your concern. Is that okay?
It's okay.
Okay. I believe you have been told about your condition in full.
Yeah.
Okay. So basically, I just want to highlight some points with you as regards to the management. Like do you want me to tell you everything in full, or you want me to tell in bits?
Regard the management for this joint pain.
Yeah.
So before the last 3 months I was seen by the consultant, and he advised me to start a medication for this disease. And he said to me that you are now in early rheumatoid arthritis, so better to start this treatment. At that time, I was not keen on this, and I have asked him to find out more about the treatment. I returned and I read about this medication. He told me that you will start with steroid, and even he will give me this, especially in the active situation, or if the pain is more severe like that. When I read up about this medicine, I found it has a lot of side effects. Gaining weight, high blood sugar, high blood pressure, even my skin become thin, even so I found that I will lost myself with this type of medicine. I didn't return back to the appointment, and I prefer to continue on paracetamol and ibuprofen. Uh, till this last time I was fine, but I start to suffering from difficulty in doing my duty in the restaurant, especially my wrist become more stiff. So I came back to to help me to give me better treatment that avoiding me from any side effect. If there any other type of medicine or to help me about this suffering.
I quite appreciate your decision you've made, and also I must say that I'm kind of, I can imagine how difficult you are, the kind of difficult situation you are passing right now. Do you mind if I tell you some things about this medication? Hello,
Sorry?
Makin. Do you mind if I tell you some things about this medication?
Yes, yes,
Okay,
welcome. Yeah.
okay. Actually, the concerning the steroid, like we are told from the beginning, the steroid is not to be given for a very long time. The steroid is only required whenever probably you have a new pain, or probably you have a worsening of this condition, which we call a flare. That is only where we can probably give you those steroids, and it is not going to be given for a very long time. We have to reduce the dosage with time, then stop eventually. But the mainstay in these treatments for your condition is what we call as the disease-modifying anti-rheumatic drugs. It is simple. They are drugs that you take them for a very long time and tends to prevent you from falling ill when you're on this medication. The drugs are very good. However, they have their own side effects. But the benefits tends to outweigh the risk. I'm going to start by telling you about the benefits. One of the benefits of benefits of such drugs, in which there are many classes. We have two of them, two common ones, which is methotrexate and sulfasalazine. I don't know if are you clear about what I've been saying so far?
Yes, yes, understand
Okay.
you.
Okay. Now, looking at the first one is called methotrexate. Actually, this particular drug is a drug that will give, is one of, in fact, is
It's okay.
the first line drug we give for this condition, and it helps to prevent the joint from
But if
coming down
uh,
with destruction.
okay.
So yeah, go ahead.
Yeah, but if I have a
Hello.
recurrent, what you say flare up, if I have recurrent flare up, and then you will give me another steroid and another steroid, this will not harm me. I mean, no way to gain weight or to develop any side effect. How you guarantee that I will not gaining weight?
And thank you so much for that concern. It's a valid question you just asked me now. Basically, when you have any new onset of pain, like which you've called as flare up, it will give you that drug for just a short period of time until the pain goes down. Then we taper it down. So probably it may not be, in terms of up to a month or thereabouts. And when we're giving those steroids, we also give you some other drug that tends to protect you from the side effect of those steroids.
2 minutes left.
So outside this, the other ones, like I mentioned, is the methotrexate, which, like I said, also does a very good function, and also it also helps to prevent the joint from breaking down. But basically, one of the side effects is that it can cause, in some rare occasion, it can result to problem with your breathing, also problem with your liver. But as it is, when you're placed on that drug, we monitor your lungs by doing some function, your lung function, and then doing some liver function tests.
Okay.
serially to monitor that. Then also, if you are like, if I be asked, are you thinking, thinking of starting your childbearing, getting married soon?
Sorry?
Are you married?
No.
Okay.
I
Do you have any intention of getting married anytime soon? Or probably having children, sorry.
I have partner, but I am not planning to become a pregnant.
Okay. Are you on any pills currently?
Sorry?
Are you on any pills, any contraceptive pills, any pills? Any
No.
pills? Okay.
Yes,
All
yes.
right.
Yeah, I
All
am
right.
using yeah,
Okay. We
pills.
may need to review you in our next meeting and probably look at how we can probably balance up with the pills and the drugs you are taking. And it's also
So
good to know that if peradventure you want to start having children, you let us know early so we can probably switch you to the another medication that will be beneficial to you. Is that okay?
it's okay. So you mean that I should, if I want to be pregnant, I should be aware that to avoid the harmness of that medication to the baby?
Yes, definitely. So we may need to review your drugs again and change it to something else like the sulfalaxine, which is sulfasalazine, which is the other ones. Any other concern?
It's okay. So, yes. Can I tell? It is okay to avoid telling my boss. I'm afraid that to lose my job.
That's a good question. Also, I must have to appreciate that too. No, I don't think telling your boss is a good thing because it will also help to probably change your job role if you are not comfortable. What kind of job do you do? But like, what kind of job do you do? If I may ask, what kind of job do you do?
Okay,
What
It's
kind
okay.
of job do you do?
time is up,
Thank you.
Dr. Henry. Yes.
All right, thank you.
Okay, what do you think her job, Dr. Henry?
That was I was asking her. She didn't tell me.
No, it's in the scenario. She's a chef, so you have to focus in the scenario, right? Agree?
Agree, agree.
Yeah, yeah. It will be as lacking if you didn't read and you ask. So means you didn't read the scenario well. Anyway, we will comment. Please, Dr. Sally first, then I will comment.
Um, I think it was systematic, but he took more time in the detail of the type of medication, um, and ignore the side of the social regard. He asked me late after the time
محمد
finished.
ولد عرفت لك كنت تجيب ولا ما سمحتوش زي اللي يجيب عليك زي ما تلعب
Uh,
يبقى امشي العب في الممر ذات واحد ذات اللي تخاف ذات الولاد
Sorry, continue, Dr. Sally.
It's okay. So he asked me late about my partner relationship, and so maybe it was he will not ask me this question with that extra time. For me, I took more time
Yes.
fixing in steroid. So I think I waste his time regard. I ask him again. So I feel that I waste his time more regard the steroid and the flare and recurrent of flare. I think this make him more keen to keep me for other option of management.
Yes, I agree about this point. Continue.
It's okay.
Yeah, you finish? Okay. Thank you.
Yes.
Okay. Thank you, Dr. Sally. Your scenario in the chat box, please be ready. We will finish discussion, then we'll be back.
It's okay.
Okay. So my comment to Dr. Henry, again, because you practiced before with me, right? You have a good way to communicate, but still you are talking and wasting time about points you should be short in the explanation. Yes, Dr. Sally was also lengthy talking about her problem when she started to be diagnosed, and the doctor informed her about steroid, and she would took time to think about it. I think in the exam they will not be as long as this way of explanation or giving idea about her disease. So the surrogate should be also shortly talking. However, if you are listening well to her, this is good point. So they will consider this as positive comment. You are listening well. So don't try to interrupt, even if she's talking a lot. Give her the chance to talk and try to answer her concern as soon as she already asked. Let's go back to the point and the task in this scenario. What do you think the task in this scenario, Dr. Henry? What the main important point you have to talk about? Dr. Henry, can you unmute yourself?
Oh, the DMARD,
Okay,
the
the
DMARD,
match
yeah.
one of the concern and one of the task. What the other point?
The other one is about the steroid and then the
Perfect.
DMARD, yeah.
Yeah, so the steroid in between for the flare up and the DMARDs for the long term management of this of the rheumatoid arthritis. So whatever you have to talk, it's the main task in this scenario, steroid. And if you don't have the good time to explain the all side effect as she was worried about them, you can tell her we have another meeting or we will arrange another meeting with you to explain how to avoid the complication of steroid. However, the steroid will be shortly taken for the flare up or for the duration that you have acute presentation, right? Or and the
Yeah.
acute setting. So the steroid will not be worry about the complication because it will not be for long-term management. It would be, however, it might happen. Still, the complication might happen, and we will follow up with you. We will reassure you that it will not happen, and we will try to be more concise in the management regarding the steroid because this is not the main treatment of the rheumatoid arthritis, right? But we will try our best to follow up you regarding these complication, okay? Because it might happen, yes, as a short term, but you have to reassure her that we will follow up her. The next point is the DMARDs. The DMARDs will be the long-term medication, including in this scenario, what written in the scenario down?
Methotrexate and sulfasalazine.
Yeah. So at least give idea about these two medication, short idea, how to be given orally or IV. Okay, it will be taken through your mouth. It will be taken as injection. The second point, how many and the frequency, how much every day, and the possible side effect and the most common side effect for each one. Particularly the methotrexate, the very important side effects, and you mention at the end, which is the teratogenicity, right?
Yes.
Yeah. So good you raise it, but you have to mention it earlier, not at the end. Okay, so these are the possible side effect and the most common one. One of them, what do you think the
Is
other side effect of methotrexate?
yeah, interstitial lung disease and liver cirrhosis.
Yeah, perfect. What else?
Interstitial lung disease, fibrosis, lung fibrosis, pulmonary fibrosis,
Yeah, don't forget the pancytopenia or bone marrow suppression.
pancytopenia. Yeah.
Yeah, so bone marrow suppression. So it might be happen. Please, if you are going to take any medication along with this medication, inform your GP that you are on this medication. Why? Because sometimes, particularly the females, if they have any urinary tract infection, sometimes the GP will give her the trimethoxyl, right, bacterium,
Yeah.
and the medication will be interact with the methotrexate, and the bone marrow will be more suppressed. Patient might present with anemia and leukopenia or all pancytopenia, right? So in order to prevent this complication, you have to tell her whenever you are going to have any medication, inform your GP you are on this medication. This is not only for methotrexate, for any medication that the patient will be kept on for a long time. Okay.
Yeah.
For how long, doctor, I will take this medication? She didn't ask you, but let's see. Let's say she asked you now. For how long, doctor, I will take this medicine?
That's a good question. Actually, this medication you are going to be taking for a very long time. Um, if
And
you, Yeah,
Yeah.
and you're going to be taking for a very long time, and we need to be monitoring you, regularly to see if there's any, to see if you have developed any of the side effects of the medication, and if there's need, if need arise, we may need to change to something else, if need arise.
Perfect. And not only that, we will see the response to this medicine. The follow up here, not only for the side effects. Yes, there is follow up for the side effect, as well as there is follow up for the response to the medications. Okay, so don't forget to reassure always about these things. If no response, doctor, what do you think I can take after that? It's not in the scenario, but I mean for further management. What do you think the next step after methotrexate and sulfasalazine? 6 months, no response. What do you think the option will be?
And thank you again for that question. Your question is valid. Actually, if peradventure you didn't respond to this particular medication, there are room for other medication which we call as biologics. These are the ones that can probably be considered in certain case. Is that okay?
Yeah, thank you. Perfect. Thank you, doctor. What do you think, doctor? I should do anything before starting this medicine?
And thank you again. That's also another valid question. Typically, and they may need to, before starting this medication, this other one called biologics, we need to do some tests for you to see if you have any latent TB, and then also we need to see if there's any, if you have any because they tend to suppress the immune system, it tends to suppress your body defense system. So we need to also rule out um, other condition like previous, if you have latent, let's say if you have any history of OTB, or probably if you are prone to have TB infection, we need to rule that one first before we commence you on the medication. How about that?
Yes, doctor. But what is the TB? I couldn't understand.
Yeah, that's actually TB is a kind of lung infection that affect the lungs, and people get it from contact. Typically, for some persons may have it, they may not know that they have it, but we need to do some tests to see if you have the asymptom. If you have it in your blood, but you're not coming down with the symptoms, which we call it as what we call latent TB or asymptomatic TB. Because
Perfect. Okay, so be sure that you are explaining something in a medical way to explain it in non-medical way. TB, and you know the TB, but the surrogate or the patient doesn't know what is a TB. So you have to say there is multiple infection. We should roll it out before starting this medicine. Why? Because it's a very effective and powerful medication that can suppress your defense system to a way you might have activation of these diseases. Don't bother about the names. We will have another meeting to explain. I am trying to interpret both scenarios because there is a lot of scenarios related to the methotrexate and rheumatoid arthritis and the biological. Okay, so all of them in the same idea are rheumatoid arthritis control or management, but the difference will be in the medication, either methotrexate, biological, reactivation of TB, what I should do, methotrexate given with bacterium, and there is interaction, pancytopenia. All this scenario related to each other, but everyone will be separate task. Okay, I don't think they can bring to you steroid, and at the same scenario they will give to you DMARDs, either this or that. They are trying to be more concise. It's 10 minutes only. So what you will do to explain one of them, or to explain the side effects, or to explain the disease, the preparation of starting biological. Okay, so be sure it will not be lengthy scenario as in the same scenario today. Today's scenario was very lengthy one, talking about steroid, talking about the demands, and even the patient ask you, doctor, tell me about rheumatoid, and this will not happen, okay? Because it's another task to explain the rheumatoid arthritis. It's another scenario and another task. Need another time to be explained, okay? Be ready
Okay.
to all these scenarios. Explanation of the rheumatoid, what the management, steroid, or DMARDs, or biological, or the interaction between between the methotrexate and the bacterium. Okay?
Okay.
You have any
Thank you.
question?
No, I'm okay. I got all the information.
Yeah,
Thank you.
please, most welcome. Please try to talk shortly and let her talk. Try to to focus on the task, focus on the job, what the patient job, because you ask her at the end, which is already written in the scenario, and she told you, not only written, she told you, doctor, I have a job and I don't know how to work with my hand. Don't tell me my boss about this issue because I couldn't tolerate. Whenever you ask later, what's your job, means you are not focusing either to the scenario or not focusing to the patient, so, which is a very bad impression to the examiner. Okay, you are focusing to her.
I have a
Yeah,
question.
yeah,
Sorry,
sure.
Dr. Bazin.
Yeah,
Sorry
yeah.
for cutting you. Yeah, like in the last question she asked me about her job, if she could
Yes,
tell the employer, the manager, our boss about her condition. You know, what how will I respond to that?
perfect. Thank you for this question. It's a very important point. What do you think? I will ask you the question now. What do you think? How to address the? Don't tell my boss about my disability or I cannot tolerate the job. What do you think?
Um, that's a valid question, but may I know why?
Because doctor, if I will work, I will be difficult to do my job properly as before. Do you see my hand, doctor? There is a lot of deformity. I cannot tolerate the job.
Mm, mm, mm. I can see you are really passing through a lot. Actually, there's something we can do to help in this matter.
Okay.
I think telling your boss, if you don't, we can tell your boss in another way, in the sense that we can involve our one of our occupational therapy who can help
Perfect.
come and perform a work assessment on your job. How about that?
Yeah, doctor. Okay, it will be much great. Thank you, doctor. So
Okay.
this is the answer. If he can or she can inform her boss by herself, or we can refer her to the occupational worker to help her in this issue. Okay, but be sure that you have to help her, but not to hide this on her boss because it's already disability. We will try to help you in this regard. If you don't have a clear answer or you don't know what to do, okay, we will help you in this regards later on. But in the best way to refer here to the occupational worker, they can have a contact with the company to help to solve this problem, either to reallocate her in another job, or uh, to find another job for her, or to make her less job effort. Okay, but don't skip this task or this concern if she asked you. Clear now, Dr. Hinari?
Yeah, clear, sir.
Okay. Anyone want to comment? Dr. Sir, you have other comment before moving to the next scenario? Anyone also has a comment, please share with us.
It's okay, thank you.
Okay, anyone want to comment? Okay, the second scenario, Miss Jennifer Lopez. She is 18 years old woman and was admitted 2 days ago as on account of acute severe asthma and treated with nebulized with salbutamol intravenous steroids. He was reviewed or she was reviewed by the consultant today, who thinks she is fit for discharge and has requested you discharge her on low-dose steroid inhaler, two puffs twice daily. Your task is to discuss the discharge request with her and address her concerns. So it's similar to our previous scenario or first scenario, but this is inhaled steroid. Be ready, Dr. Sally, ready?
Yes.
Okay, here you go.
Hello, I'm Dr. Abdelal. You are Mrs. Jennifer Lopez, and 18 years old. And 18 years old.
Yes, doctor.
It's okay to discuss with you about your condition.
Yes, doctor. Yeah.
Can you tell me what you know about?
Actually, doctor, 2 days ago I was sick and I had this terrible wheeze and chest tightness, and I was rushed down to the hospital, and the doctor, they saw me and they gave me some medication. Some I have to take through my blood channel, and I'm kind of better now, doctor.
Yeah. So how is your feelings now?
No, doctor, I'm good. I'm good. I'm no longer here. Do you feel, have that chest tightness any longer? I'm good. I'm good.
Yes. So I'm sorry for what happened to you, and I'm feeling happy that you are now in a stable situation. Can I know which type of medication you was before these attacks of asthma?
Yeah, actually, I was taking this blue inhaler that my GP gave me. Yeah, so that's what I've been taking all this while, doctor.
Okay. As you know that the consultant saw you today, and he asked after he found your situation is stable today. He planning to discharge you. He planning to discharge you, and to add for that type of blue inhaler, other type of inhaler. Is this okay with you?
Yes, it's okay. It's okay. It's okay. It's okay. So,
It's okay.
so I cannot go.
Sorry?
Do you want me to go home?
Yes. Yes.
So, are you adding? You said something. Are you adding any medication for me?
Yes. Yes. They will add. I will add for you other type of inhaler called steroid inhaler. Do you know about this?
Steroid.
Yeah, steroid inhaler.
Doctor, I'm not taking steroid.
Sorry?
I'm not going to take the steroid, doctor.
Why?
Doctor, the reason why I will not take it is that my aunt, was sick. He had a problem, which they call some joint problem. I have been taking steroid. My mom, my aunt, who was very thin before, now is very fat. Is looking like a cow. He's shapeless. He has some bruises over. No, doctor, I cannot take that steroid. I will not take steroid, doctor. I will not.
So you are right that steroid it make gaining weight and it affect the blood, but this type of inhaler of steroid it has no effect in your body. It just spreads through the air tube, and it has a local effect. It support the other type of inhaler to maintain you and to protect you from other recurrence of that severe asthma. So it will not affect your weight gain, it will not affect your blood, even other side it will not affect. Is this clear with you?
Yeah, okay. If that's the case, it's okay. So does it mean that it doesn't have any side effects at all?
For your body parts it will not affect you, but I want to give you more information. If you use this locally for your inhaling, it may make some oral thrush or some soreness in your mouth, and this could be protected by washing your mouth after inhaling that steroid. Is this clear with you?
Yeah, it is clear.
So
So whenever I use it, I will just wash my mouth and everything will
yes.
go.
Yes.
Okay.
So they will give you a small dose, and this is inhaled. And if I will let the nurse to help advise, explain to you more about the way of using inhaler. Are you aware of this using of an inhaler in general?
Yes, I've been using this blue inhaler for a very long time. I can use it very well, doctor.
So it will be the same way of inhaling like the blue inhaler. Is this clear with you?
Yeah, it is clear. It's clear, doctor. It's clear.
So can I know, did you smoke?
No, doctor, I don't smoke. I don't smoke.
Did you consume alcohol?
No, doctor.
Okay. So can I know what is your job?
Doctor, I'm a singer. I'm a musician. Yeah.
It's okay. Any pets or birds in your home?
Not at all. I try to no, not at all for now. No.
Okay, thank you.
No.
So can I know if you have any concern?
Yeah, doctors. since I'm a singer, would this steroid that you are prescribing, will it affect my profession, my job?
This type, it will, as I told you, if you wash, it will not affect, it will not make any residual effect in your mouth. It is a temporal effect. It just it support the other inhaler by preventing the recurrence of the disease.
Okay, so I mean, if I'm using this inhaler and I'm washing my mouth, it will not affect my voice. It will not affect anything. It will be. It will not affect anything, any part of my voice, right? Okay.
Yes,
Thank
if
you so
you do
much,
this
doctor.
inhaler properly,
Okay.
it will not affect your voice. Is this clear with you?
Yeah, it's clear. It's clear, doctor. Then if that's the case, I'm willing to take the inhaler then, because I'm so concerned about my voice. I don't want anything that will affect my voice. I have my next audition coming up in a week's time, and I want to
Yes.
sing properly.
Yeah, so if you notice any change in your voice, return back to us to recheck if there any infection. Sometimes they could develop some bug in your in your mouth or in your throat. So if this develop, it can affect your voice. But this occurs after not properly using the inhaler. Is this okay with you?
Doctor, like you said, my only concern is that if it doesn't affect my voice, I'm ready to take it. But if it affects my voice, I'm not taking it. That's my concern. But since you've assured me that it's not going to affect my voice, then you can give it to me, doctor. You can give it to me.
Yeah,
Mm.
it's okay.
Mm.
So, do you have any other concern?
Yes, doctor. Doctor, how long will I take this inhaler, the one you are giving me now?
Um, in this time, you need to be in regular using of this type of steroid. And you will be under regular follow-up till they decide you need to continue on or to stop this type of inhaler. This
You
depends
mean
on your situation.
you mean I want to take this inhaler for life till I die?
2 minutes left.
So I can't guarantee that you will continue for life or not. This depends according to your situation. If you will develop a recurrence of that severe attack, it means that you will need to be continuing this dose. So it depends on your situation at that time.
Okay.
Is this clear with you?
Yeah, it is clear, doctor. It is clear. It is clear.
So do you have any other concern?
Not at all, doctor. I think I'm.
So
With what you just said, I'm okay.
sorry?
I'm okay. I'm okay, doctor.
Yeah, it's okay. So can you tell me what you understand from this discussion?
Yes, doctor. You said I'll be discharged today, and you give me a steroid inhaler, which I'll be taking it the same way I was taking my formal inhaler I was taking. That whenever I'm taking it, I should wash my mouth. And when I wash my mouth, I'm not going to have any other complaint again. I can go ahead with my normal activity. Nothing will happen. And thank you very much for that. That's what you said.
It's okay. So if you want to know more about this type of inhaler, I can give you a website link address to know more about this type of inhaler. And if you need more discussion, I can let my consultant to sit with you and to explain to you more about this type of inhaler. Is this clear with you?
Yeah, it is clear, doctor. It is clear.
Okay, time
Thank
is
you.
up. You can comment now.
All right. Thank you very much. That was a good one. You asked of the setting. You asked of my knowledge. You told me about your plan of the doctor, of your consultant, my discharge, and then the commencement of the new medication. And initially I was not happy with it, but you convinced me that this one was quite different. That it's going to be taking the side effect. This one doesn't have side effects. The only side effect that this one has, that it can cause some oral thrush, And then basically, and now probably where I kind of have, issue with the communication was you are showing you are over showing me about the steroid inhaler that is not going to affect my voice. That once I take wash my mouth, I'm okay. Basically, that is where, in fact, that is even the meat of the matter. At that point in time, you didn't explain the side effects in full to me. You only gave me half of the side effect, which is the other trash, and then you told me how to go about it. But at that point, you should have tell me that truly, that this particular steroid too may also affect his voice, because one of the side effects of inhaled steroid too, it can cause hoarseness of voice. And if you know that I'm a singer, there's a high chance that this particular drug will affect my voice when I'm singing. So you are supposed to probably, first of all, tell me that, okay, fine, truly, this particular drug might affect your voice, but however, it should. One of the things is that if he doesn't take this drug, the voice that is the asthma itself can also cause can cause can further cause a problem for him. And then taking the drug will help to also open his lungs that are kind of looking tight, and then giving him more ability for him to breathe very well and have a good voice. However, it has a drawback. One of the drawback is that it can also cause hoarseness of voice. But this can be minimized to the barest minimum by either using a more specialized device called a spacer. A spacer device is kind of it will make the drug to be sent straight to the lungs, then and then have shorter stay in the windpipe. So therefore, the risk of him coming down with hoarseness of voice is minimal with spacer than the inhaler that was being prescribed to him. Another thing is that, like you said, the use of mouthwash, washing of mouth after each use. And then the last one is that him having the dose that you are giving her will be a minimal dose. Because since you are reducing dose, so the lower the dose, the lower the chance she has of coming down with such complication. So, and also you can also probably tell her that presently there's some newer inhalers that are being produced, but we have to discuss that with your pharmacy to see if they have any specific one that may also help in relation to that voice. So these are the other things you should have probably tell the patient, and probably assure him that, okay, if then safety netting, if peradventure she notices anything that probably beats a little voice crack or any other symptom that you've not mentioned that is then the side effect, you should hurriedly inform a GP for advice, or call or come to the hospital for an advice. These are the part that probably should have thrown more light on. I think to me that's my only suggestion in this case. But outside that, it was a good one. Thank you.
Okay, thank you, Dr. Henry. Any other comments?
I think the other comments too. Okay, I've talked about the safety netting. Then the issue of also probably you should have linked me up to either the specialized nurse or the pharmacy to further explain it to me. You shouldn't have take all the explanation alone. You should have also probably tell me that, okay, you also inform the specialized nurse to also further come to tell me how, because sometimes some inhaler might not be the same thing. There are many inhalers that have different approach. The way you use your what do you call it, discuss inhaler, it's quite different from the way you use your what do you call it, the meter dose inhaler. That many kinds of inhaler, which their method is quite different. So don't be so certain that it's the same pattern, the same way the meter dose inhaler that she was using for the salbutamol, it will be the same one she'll be using for the steroid inhaler. Maybe the pharmacy might have some other thing in mind. Probably the Discord inhaler or any other inhaler that might be quite different from the meter dose inhaler, because it has different forms. So you telling her that it's going to be the same way to me, I felt that you are over generalizing the whole thing. You should have tell her that probably when she go to the pharmacy will give her, tell her how to use it and what to do to, further give her some other advice that you've not given to her. That's just my only addition. Thank you.
Okay, thank you, Dr. Henry. Well done, Dr. Sari. I will just add some comments more than or stressed or more to the point of the side effects. Okay, because you said no, it will not. You are talking like something will not happen. Do you have any guarantee, Dr. Sally, all these things will not happen?
No,
So how you can reassure her that nothing will happen? Her voice will be okay. Nothing will happen regarding the weight gain. Okay,
uh,
logic. Yeah, yeah. Talk. What you want to say?
regard the weight gain, according to my knowledge, because it is a local effect,
Yes.
so I thought weight gain is away from to be a side
Yeah.
effect.
It's of course it's very less or minimal compared to the systemic oral or injection, but still there is
Yeah, it's
maybe
okay.
maybe there is possible minimal dosage might be absorbed and it might cause gain weight. But don't worry about this issue. We will follow up with the dietitian, okay, to help you not to have this side effect. The other one, the voice. Do you think the steroid 100% will not cause hoarseness of voice?
صراحة أنا ما كنت أشور يعني على إنها هي ضمن
Yeah,
السايد.
so don't give no or absolute no. Okay, so it might happen. However, we assure you that we will use a spacer, as Dr. Henry said. We are using a spacer or a technique or a tool we can that can help not to have spread of the steroid to the area of hoarseness of voice, which is the vocal cord she's worried about. So the spacer will help to avoid or to prevent or to minimize the side effect as much as we can. We are trying to reassure you regarding this. So these both two points of clinical judgment, you have to be clear about that. Don't give absolute no side effect or it will not happen at all. Why? Because it might happen and the patient will come later on to tell you, doctor,
Yes,
you promised me or you said it will not happen. So what you will do that time, it will be considered as error. So
yes,
what we have to tell and we used to do to say there is minimal compared to the systemic one. Okay, this is regarding both clinical judgment point. One more point I want to tell you. When she told you about her aunt, she said my aunt become like cow and she gain weight. You said yes, it can cause. What about her aunt? Did you address or did you talk? Did you show her some empathy regarding that?
no,
Did you appreciate her knowledge about the side effect of the... So try not to answer the question quickly. Try to appreciate, try to show her you are following, try to show her some empathy if she's talking about something bad for her parent or to her relatives or cousin or whatever. Try to show her some of these emotions because it will consider like you are not reacting to her work, to her talk. So how to do? Yes, I'm so sorry about your aunt or what happened to your aunt. Yeah, there is possibility. Then you can explain whatever you want to say. Okay, please always appreciate or to tell her or show her that you are feeling sorry to her emotions, to her sharing informations. Okay,
yes,
any question or concern, try to appreciate it. Yes, I can see how much you are worried. It's good to know that you are knowing about this complication. It's good not to have smoking, okay, because smoking one of the things you have to address, and you already she's not smoking. But better also to appreciate that yes, good you are not smoking because always the smoking affect the windpipes, okay, and it
yes,
might worse the asthma. Okay, what other point we have to talk about in this? So we talk about the hoarseness of voice, we talk about the spacer, we talk about the side effect, gain weight or weight gaining, and how to avoid these things by referring to a group of doctors along with the specialized nurse who will tell you how to use this. Okay, she will tell you in a proper way how to use and the technique how to use these inhalers in a good way.
Exactly.
Yeah, the smoking, the job, and alcohol as you address with whom you're living. Yes, one more point. In order not to have ask as a question, do you have a pet at home? Yes, it's good and direct point related to the asthma itself. But in another way, you can give her some instruction. Please try to be away from these things. It might worsen your asthma. And you can enumerate a lot of them, including the pet, including the animals or birds. Even if there is some painting in your building or any chemicals you are putting, perfumes, all the things will help you to have good and safe exposure and to not to have a lot of the relapse or attacks of asthma. Okay, why? Because all the things can activate and it can worsen your asthma from time to time. This is the
Yeah.
safety netting, and not to ask her as a question. Yeah, no, you can give her as advice at the end. Please start to be or try to be away from these things that it might worsen your asthma, including, as I mentioned, you can enumerate whatever you want to say and let her know more from the asthma websites or groups or leaflet, brochure, whatever. At the end, you can offer her these things. Okay. So
Yes.
this is regarding the social, the safety netting. The introduction was good, as you explained. And if you want if you want me to explain about the disease, no, doctor, you have to ask this question, and definitely she will not tell you. She will not ask you, please explain. She will tell you, yes, doctor, I know about asthma, but what I want to know now, what you are giving to me, or what you are going to give to me now, apart from the inhaler which I'm on already. Yeah, otherwise you did well. You are calm, but try to be more sympathetic and empathetic in between. Any family member suffering from any point, any disease, or any condition, please appreciate this and be sorry. Try to show some sympathy and empathy to this family member. This is not only in
Yes.
this scenario, this is a general rule in the PACEs. You are showing some sympathy for the welfare. You are trying to gain more marks to show the examiner and to impress the examiner that you are taking care of every point have been discussed with the patient or with the surrogate. Clear?
Yes, clear.
Okay. Any
Regarding
other?
the
Yes.
question about the long-term use of inhalers,
Perfect. Yeah. Yeah, it's a good point to raise it. So you said it in well or in good answer. Yes, it could be for long term. And from time to time, we will reassess you. If you have good improvement, good response, our doctor will give you update about the next plan. You don't know what will happen. She might be worse and you might increase the dose, as you know, the stepwise management of the asthma. Or it might be improved and you can keep her on the same dose, but I don't think it will be reduced or sorry removed because as the steroid as inhaler, it's very important in the anti-inflammatory effect for the asthmatic patient. So the best answer, you will refer her to the chest doctor. He will follow up you from now from time to time to check the response to this medication, and accordingly they will decide. This is the best answer for any medication will be taken for a long time. You are not giving as lifelong. Yes, it might be lifelong, but you don't know what will happen. It might be increased. And in the same time, you didn't tell her we will stop it, which is against the policy, for example, or guidelines. You don't know if she will be stopped or it will be continued. So the most accepted answer and neutral one, we will reassess you from time to time, and we will let you know if you will continue this medicine or we are going to stop it. Not only for the disease today, I mean the steroid, for any medication will be given to any patient, but it could be for long time. This is the main role of any medication will be given for long time. Okay, it will long time, but as I said, maybe it will be assessed to know if you can increase or decrease or stop. Okay, as a general rule, Dr. Sally, you got it?
It's okay. Thank you.
Yeah. Any other question?
No.
Yeah. Okay, thank you. Any question, Dr. Henry?
No, not at all. Thank you so much.
Most welcome. Anyone want to comment? Anyone has a question?
Thank you, Dr. Hinari.
You're welcome.
Okay, best of luck, both of you. Anyone want to share point or to address any concern, to add any suggestion, to explain any point I missed? So both topics clear now for all. Please, counseling about a medication is very common and topic and high yield topic in PACES. Be sure you are talking about the medication, how to be used, the frequency, the route, and the possible common side effect. Please, if you have female in the childbearing age, to address the pregnancy according to the medication side effect if it has any side effect on the pregnancy. Don't forget to ask this question, even if just asking the question without going deep to that point. Okay, at least address the pregnancy point. Or if she is planning to be pregnant and the medication will be harmful, refer her to the gyne doctor, or which is the woman doctor. She will be following with her. Okay, as in the methotrexate scenario.
Mm,
Okay,
okay.
any other question?
Not at all.
Okay, one more comment in the chat box. Dr. Salma wrote, long-term use of inhaler steroid, no systemic effect with long use or only local effect. As I mentioned, Dr. Salma, both might happen. Even you are using the spacer, you are following the technique, but still there is minimal possibility to have side effects. Either it's hoarseness of voice or even the systemic side effects. But it will be minimal, very minimal compared to the other route, like oral or through blood channel. Okay? So this is the best way to address this point. Okay. Thank you, everyone. Thank you, Dr. Henry, Dr. Sally.
Thank you.
We'll end the session. See you tomorrow, inshallah, with the short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.
Thank you.